Hello everyone, and welcome to the third video in a four-part series of short webinars for the Minnesota Health Literacy Partnership's 2022 Health Literacy Month campaign. In the previous video, we looked at the origins of the teach-back method and how it's used to improve patient understanding of health information. We also talked about a sister technique known as check-back, which shifts the checking of health information from the healthcare provider to the patient. This webinar focuses on plain language use. We'll begin with an overview of what plain language is and move on to a historical timeline of plain language events and initiatives in the United States. Next, we'll discuss how plain language can be used to avoid confusing medical jargon. Finally, we'll briefly talk about how plain language is related to health equity, which is the topic of the next and last video in this Back to Basics webinar series. As the name suggests, plain language is all about using easy-to-understand words. The Minnesota Health Literacy Partnership defines plain language as clear communication that your audience can read or understand the first time they read or see it. Using plain language helps people find what they need, understand what they find, and act appropriately on that understanding to best meet their needs. In the context of medicine and public health, plain language is a tool that improves health literacy and health outcomes. Now that we've discussed what plain language is, let's take a look at some historical events and initiatives that aimed to improve plain language use in government and beyond. In the 1970s, Presidents Nixon and Carter each took action to make federal government communications easier to understand. 1984 marked the start of the plain language column in the Michigan Bar Journal, the longest-running column on legal writing to date. 10 years later, the Plain Language Action and Information Network, or PLAIN, a group of federal employees that supports clear communication in government writing, launched its original website. In 2006, the Federal Emergency Management Agency, commonly referred to as FEMA, published an alert stating that plain language is a public safety matter. In 2010, President Obama signed into law the Plain Writing Act of 2010, which requires federal agencies to write clear government communication that the public can understand and use. The last event featured on this slide is a more local initiative that occurred several years ago in my home state. In 2014, Minnesota Governor Mark Dayton signed an executive order that required the state government to communicate with the public using plain language principles. Using plain language can help patients better understand health information by avoiding medical jargon. Unfortunately, the healthcare field is filled with confusing medical words and acronyms, such as MRI, HMO, hypertension, and A1C. Not only are unknown medical terms confusing for patients, but they can also cause additional stress if a patient is already experiencing disease or discomfort and is worried about their condition. Healthcare providers can use simpler words to explain health information to patients in a way that helps avoid unnecessary stress and confusion. I've included a few examples of how plain language can be used to translate medical terms into simpler words. Instead of hypertension, a provider could say high blood pressure. Inflammation could instead be described as puffiness or swelling. Rather than saying blood lipids, a provider could instead say fats in the blood. And comorbidity could instead be described as having 2 or more diseases or medical conditions at the same time. It's important to note that complex medical conditions, diagnoses, and procedures can be challenging to explain using simple words. In some cases, medical jargon may be difficult or even impossible to avoid completely. But healthcare providers should still try to communicate complex health information to patients as clearly as possible. Our last discussion in this webinar links plain language use and health equity. Using plain language in healthcare settings and in public health communications can help advance health equity, where all people have the chance to be as healthy as possible. A key part of health equity is ensuring that no one is disadvantaged from achieving their full health potential due to their social position or other socially determined circumstances, such as race, education level, income level, and English language ability. Historically disadvantaged groups, such as immigrants and persons with low reading ability, are more likely to experience linguistic, cultural, and other barriers when seeking health care. By using simple words to communicate health information, healthcare providers and public health practitioners can help individuals from disadvantaged or marginalized groups overcome barriers to healthcare and achieve the highest level of health possible. There's so much more to discuss about health equity, which is the topic of the 4th and final video in this webinar series. The national conversation about health equity has focused on changing systems and policies that have led to wide gaps in health across different demographic groups. In the next video, we'll discuss different vulnerable populations and ways that governments, organizations, and communities are working to advance health equity.